So for all those who would hear this podcast, I mean, good morning, good afternoon, good evening. A quick introduction about Sami. Sami is the director of call center operations. He's been recently promoted. Congratulations, Sami.
Oh, thank you so much.
But I always feel that you've always acted like a leader, right? So it does not matter.
As they always say, act for the role that you want, not the role that you're in.
Right. So, Sammy, as you know, and again, just for this podcast, I lead the healthcare business for Lead Squared,
Hmm.
and I've known Sammy for a while now, for a bit.
Yeah, so going almost close to a year. Yeah.
Yeah. So, but Sammy, for everyone who'll be listening in, tell us a bit about yourself. And I know you are the one who drives the day, but what drives you every day?
Yeah, so just a little bit about my history. So I've been in call centers now going on 15 years. I started when I was 23. Honestly, I just wanted a job that was in air conditioning. I was tired of working outside. I was like, it's too hot. I didn't care what the job was.
Hmm.
And it was very interesting. I always have this type of bravado that I like to know everything. So I work very diligently to be educated. So I make sure that I learn every process, I eliminate silos around me. I just like to learn. And I was lucky, early in my career, I had a leader. He was a VP who saw potential in me and invested in me and said, "Hey, I see more in you than you see in yourself." And at that time, I didn't want the position. I didn't want to get into leadership. I didn't see a value. I was like, okay, so let me get this straight. I can get yelled at by my team, and then I get yelled at by upper leadership when my team doesn't do their job, but I can't yell at anyone.
Yeah.
So I was like, I don't know if I wanted this, but he didn't listen to me. He's like, no, you're doing it. And again, it's like sometimes pivotal moments change your destiny in life. Because again, I never thought this was never a career goal, but once I got into it, I really, and what you mentioned, what drives me, and honestly, it's improving people's lives. That's honest truth. Now, my original organization was a testing organization,
Mhm.
regardless of race, gender, background. We just gave you a test to prove that you had the knowledge to do the job. So that I like that, knowing that, hey, you prove that you have the knowledge, and now you can get the job that improves your life, and then it makes you a better income, better for your family. Just I like starting that catalyst. And same thing here. Now that I'm in healthcare, it's the same thing. It's
Yeah.
people are reaching out because they need help, and we're helping them to better their lives. And I just like it. Just there's like little teeny wins that I just enjoy every day. Just impacting one person, just like putting good karma out there that I like.
Oh, tell me something, Sammy. Since you mentioned, when you started out, you did not really want to be yelling at someone. I know you're kind. Knowing you, I know
Yeah.
you're kind. How do you still continue to lead and keep the kindness at the same time, right? Because when the going gets tough, you got to be tough. You have to make tough calls. You have to be a little rough at times. I don't
Yeah.
know. You tell me.
Yeah, so it's a little bit of a geeky thing about me, but there's a statement that I saw from a TV show years ago, and I hear it all the time. It's from Star Trek. Anyone would know this, but the needs of the many outweigh the needs of the few.
Mm.
So as a leader, I can't look at individuals all the time. I try to be empathetic. Just like every patient, we have to take the time and listen to their circumstance and give them the best resolution. But again, there's things you have to adhere to, and the organization as a whole has to be followed our processes. Same thing with my team. At the end of the day, I always focus on the team as a whole. So if I'm having one individual that's impacting my team negatively, I have to think about the team as a whole. So
Mm.
that kindness comes in, I think of the kindness for the other remaining team members that need me to be a strong leader, that need me to make the right decisions, to make those hard choices so that they can get the job done that they need to do, which again, then in turn will make a better patient experience. And it sounds simplistic because it's not.
It is not.
Sometimes you just have to look at the bigger picture. You have to take a bigger view on what the holistic decision you make. And I think every leader knows whatever decision you make has to become the new ways of working. You can't, keep tweaking things. You have to kind of create processes and implement them. And those are the hard decisions I've had to make. But at the end of the day, when I look back at the remaining team members, the ones that are doing what they need to do every day, and they're there for my patients, then it makes me feel like, okay, I've made the right choice. Even at that moment, though, it can be difficult at times.
In fact, since I know this, um, you are someone who successfully runs a remote setup, right?
Yes. Hmm.
And most of the folks who lead call center operations in the healthcare, I've seen a majority of them operate out of one single place or say multiple places, but at least offices. How does this remote setup work? And for an organization your size, which keeps growing, not even by the year, by the month.
Yeah, so that's a very good question because when I joined Clearway, they actually weren't working remote. That's something we kind of transitioned as I got here. But something that I've always said is because they're sitting at their desk doesn't mean they're working. There was a study done. This was in the height of COVID that said that people were actually working harder from home. The right people, like not all people. If you're not a good employee, you're not going to be a good employee home or in office. Because again, if everyone was great in the office, then why would anyone have attrition? To be very honest, no, you
Yeah.
still have to have. If an individual is not doing the right thing, they're not going to do the right thing no matter what. It's finding the right people is number one, but number two, empowering them to do the right thing.
Mm.
Because I don't believe in micromanaging. Because again, if the study was done where they watched eyes and watched what they were searching, so like individuals were working, they were working less in office than at home because they felt guilty. It's a weird psychological thing. When you're in the office, because people see you, they just perceive you working.
Mm.
So people would walk by, manager would see them. Well, manager didn't walk around to go see what they were doing. It's like, oh, they're sitting at their desk and they're working.
So how do you, when you run such a large remote team of operations, how do you ensure that, I mean, what do you measure? How do you measure your
Oh,
team? In terms of, at the end of the day, everything rolls into patient experience, right? How do
yes.
you how do you measure this in terms of, running a remote team but being, you know, equally swift? Uh,
Yes. It's three rules I follow by. So I follow by SLA. So what's our goal? So how quickly are we getting to the patients if they call it? Number
mm,
two, what are we saying to the patients when we're speaking to them? That's quality assurance. And then third is tracking productivity, which is again the scorecard. Having these three metrics are key, but the key is to let the expectations of your team know what we're looking for. I always find it very interesting when I ask my leaders or anytime I have anyone that, have a situation with an employee, and I'm like, did you deliver the expectations? Look at what I told them. I was like, no, delivering an expectation is documenting it,
yeah,
meeting on a bi-weekly, saying, are you meeting this? Are you consistent? Because again, you can't meet someone at the end of the month and be like, hey, you did a horrible job at the end of the month. It's about doing the little things. It's the continuous communication. So remote or in office, it's constantly just meeting your staff where they need you and understanding where they need to improve and constantly that communication is constant improvement. It isn't about perfection, it's just constant improvement.
true. And I think I'm hearing this a lot across the industry, because Lead Squared, right? I
Yeah.
mean, uh, and each of these conversations that I have, I constantly hear different versions of, hey, we want the speed to comfort.
Mm-hmm.
A lot of patients do reach out, are not looked into, get a call back, get a communication, get scheduled, say days after, and some fall through the cracks as well. So the core of it is speed to comfort, right? How speedily can you bring comfort to them? And that's at the core of what you do as well.
Correct. And you mentioned Lee Squared. There's a reason why we partner with you guys. Because again, it's not just about the speed. It's also, like you said, managing and knowing when we need to reach back out, what slipped through the cracks, helping catch those things. Again, when we receive a referral, I do believe everyone's going to work our due diligence. But again, when you have human interaction, there's no perfection. And having Lee Squared kind of being that safety net, catching the things we missed, helping automate things, helping triggering things that don't require that, where the patient is getting the best service where our staff is focusing on the things that we couldn't get automated, then it's like a two frontal attack where the patient is just getting a phenomenal service without knowing that, hey, we're partnering to get these results. To them, they just got the communication. They had no clue that was automated through a system. It's all those cool little things where it just wants to be a smooth, seamless process for the patient. Because again, especially in our specialty, with Clearway's pain management, these people are not in a good situation. They're hurting, they're having difficulty, they just want to get life back to normal, and I don't want to make any hurdles or any difficulties. And Lead Squad helps smooth that out for us.
True, true. And thanks for being a partner to us. Uh,
No, appreciate it.
in fact, I had a script, Sammy, for today's podcast, and every time I talk to you, I get so curious that I go off script. But
Yeah, my direct my VP Janine, which I know you're gonna have a fire chat with her. She always says that like we start in one place, and then we get lost and forget how we even got to where we're at. But I think those are the best things about conversations. And again, that I think helps with inspiration. Again, that motivates me. See what drives me every day. These type of conversations are thoughtful, and you think about every little step of a patient's experience and what we do to make their lives better. Just, I don't know. I like that. It makes me, because I've worked in retail before, and I'm gonna be honest with you. Sometimes I'm like, it's not that important. Like I used to work for a cable company. I was like, cable's not important, but with these patients, I think everything's important. Every single interaction is life changing to them.
True, true. I think we were at HCCT, uh, and I still remember, and I just loved that session. I wrote about it on LinkedIn as well. Uh, the real life examples that you were bringing on stage when you were speaking, those
Hmm.
really mattered. But
Yeah.
tell me more. How did you get into healthcare? What's the journey been like?
Yeah, that is very interesting. So, my journey wasn't a normal one. As I mentioned, Janine, the vice president of patient experience at Clearway, she had reached out to me. We've worked together for almost a decade now, but at that time it was about 8 years. Meaning we worked together in two previous organizations. And I didn't really have healthcare experience, but she needed some of the new call centers. I
Hmm.
think something, when I joined the organization, I had to learn the healthcare part. I understood call centers. I understood how to work metrics. I understood how to create the scorecards and create the accountability needed to get the right staff to provide the right support. I just didn't understand the product, as I would say, the procedures that we offered, the medication we did, the insurances. Those are things I had to learn into healthcare. And it is, I do find it is a very tangled web. All the things you have to jump through to be able to assist a patient. But these are
Hmm.
very important things to make sure that their process is smooth. And that's where I had to learn in. And that's how I got in. I was reached out and I was acquired and I came and joined the organization. And I've been here now for 2 years and I just can't see my life any other way. Like it is
I,
meaningful and it can be stressful at times. But again, nothing's more rewarding when you get through that and
true.
get through those hardships and understand things and understand what we need to do to make someone's experience a little bit smoother here at Clearway.
And I think, Sammy, I think that journey has now evolved, right? Uh,
Yes.
because now you're not just new to healthcare, you're now new to various acquisitions that Clearway makes, and then
Yes.
how do you streamline them and bring it all together? Tell us more about how you do that, because I mean,
So yeah, so
the
the
growth at a
easiest way I
rapid
can
pace.
do it is I never look at the holistic picture. So I always tell people if you look at everything as where you want to get to, it becomes very daunting. You know, the best way I can tell people is when I look at a tower and it's 100 stories tall and no one ever thinks it starts with one layer and you keep building upon it. And that's at any acquisition, any growth that we're doing. I just look at what's the first step that I need to do, and then I think about the second step, then I think about the third step. The next thing I know, I'm 25 steps in. I'm already halfway through the journey
Yeah.
to get to where I need to. And as we continue to grow, is just taking the best practices. And I think something that maybe I think I've done in my career that's gotten me to be more successful is taking that moment to stop and reflect on the journey I took to learn from it. The lessons learned. It wasn't something I was good at. And once I completed something, I was like, great, let me go to the next project. But I never sat back and reflected, say, okay, this is what I learned. This is what I wish I knew at this time to make sure that the next implementation, the next growth, the next acquisition is more smoother. And that is literally something since my 2 years experience, multiple things that even with Lead Squared, we acquire, you guys joined our practice and we had to implement you. And we did our first region. We had so many lessons in that one. Now we're in our second region, so much more smoother. And then when we do our third region, that's gonna be like the easiest one of all. Again, you keep learning. It's just taking that second to reflect instead of just jumping into the next project.
So true, because I've been doing my rounds recently, and I see a lot of these mergers and acquisitions take place, right? Uh,
Yeah.
what they call it on the street is the deals are back. So there was a period in 2021, 22 early, where there were a lot of these mergers and acquisitions happening in the healthcare space. And then there was a lull period for about a couple of years. And now this year we are already seeing so many practices get acquired, a lot of PVC interest, but and everyone's striving to, after the acquisition, everyone's striving to build a synergy, integrate all these, acquired practices. Um if you were to advise and if you want to give your recipe out, what would these 3 points be that anyone acquiring a practice should look at in terms of, streamlining operations, technology? And you can choose to not answer, because I know you may not want to really give your
No,
recipe.
I mean, I won't say it's a secret. It's just honestly, so I don't know if it's 3 steps, but the first step that I've noticed, and from my experience, is honestly understanding who you're acquiring. So I think there's always a trend, or what I've seen some when acquisitions have gone, not as smoothly as they should have, is where you get an acquisition and you tell them you're joining us, so you have to do it our way,
Mm-hmm.
and never taking the opportunity to understand that practice, because every practice is unique. No matter how many offices, even if you're in the same organization, sometimes offices operate differently. Because each provider kind of wants to do things differently, do different procedures, they do different medication, they do different practice styles. Understanding what they need and then telling them there's a better way. It's not forcing someone to. There's a thing that I learned years ago called Lake Mead. The more you can make it about that individual, or make it more about that practice or the organization you're acquiring, it's about them. Like, this is going to make your life easier. This is going to make this smoother. This is what this is going to do for you. Then you're going to get the buy-in. It isn't always about forcing someone to do it. It's just letting them see it themselves, realizing it themselves. And I hate to say this because I'm a very movie buff. There's a movie called Inception. You need them to realize the ID themselves. You're going to want them to want it.
Yeah, 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 yeah.
And that's all I really try to do is, I think, and I do think I'm very charismatic, but it's really just about me trying to tell them, this is what I'm really trying to do, is to make your life easier. What is their goal? Understanding them, and then having them to align with what the goal is. Because I have yet to meet an organization that all don't want the same thing. They all want to help their patients. They all want everyone to have a smooth experience. They want to be able to make sure errors are not being done, patients are getting answered, and we're getting paid. So those things, like, letting them know that that's what we're going to help you with, makes
Mm.
them want to buy in. And then when they do join you on that mindset, then you don't really have to do anything other than support them, because they want it. Now they're asking you. So instead of me forcing myself upon them, you kind of just like, I'm here when you guys are ready. And that sometimes that might take a couple of weeks. I know there's times where it's taken months before I've gotten that buy-in, but it's being consistently available. But I
Mm.
think anytime you try to force is resistant. Again, everyone fears change no matter how it is. There's a joke someone told me once, that if I left a box in the middle of a hallway, but
Mhm.
never told anyone what that box was, and they walk by that box every day, no one would notice it until I move that box.
Yeah, true, true.
Then everyone's like, where'd that box go?
Yeah.
No one knows why that mentality is in us, but understanding that mentality is, you just need to be there until they need you. Because the day they need that box, they hope that box is there.
Mm.
And that's how I look at it, just being available and empathetic. It's not my way or the highway. It's like, what can we find that equal to get the success that we're looking for? And I think when any acquisition is, we're trying to succeed together. That's the whole point of an acquisition. Isn't I want to bring you here so you fail. No, you're now a part of us. So we want to make sure we all succeed.
No, that makes sense. That makes sense. Sammy, we see a lot of coming to the call center space and healthcare on both sides. I mean, call center as a standalone entity and healthcare, we see a lot of attrition happen. You know, and we've seen that in the call center industry for the longest time. Healthcare, we know there is a what they call the doctor's drought on the clinical side, and still, there is a huge gap in the number of folks we have in the front office or the intake staff. What does a day-to-day look like for you in the call center environment or the intake environment, and how where do you feel there are gaps could be made better, or tell us something about where you've already made it better?
Yeah, so honestly, it's the information we want to collect. I think the hardest part when it comes to intake is there is details we need, but there is things we need to collect. Sometimes we go overboard, and do we really need everything to provide the patient? I always think it's very funny when we're trying to ask 37 questions. Really, you only need 10 to get the patient scheduled. Because again, even when they come in, we can collect it. It's like we try to get everything up front because we want everything to be so perfect up front that we're putting this burden on the patient. And if
Hmm.
you're thinking about the patient's experience, they're in pain, they might have been in an accident, got hurt at work, or they're just dealing with something that's chronic. And now I'm grilling them with 37 questions,
Hmm.
making them spend an average 15 to 20 minutes on a call, and us understanding what is necessary to be able to see them and ensure that the experience is good, and what is preferred to be collected. That was a big conversation. Me and my organization, I feel like we did a big part of that, having that conversation and not over asking questions. Additionally, I think what we've done big this year, and again, Lee Squares has helped us with that as well, is touch points with patients. It's not just reaching out to them one way. When I first joined Clearway, everything was phone calls. And
True.
I think a lot of people don't answer calls anymore. The connection rate's lower with the amount of spam that's happened in this world. A lot of people don't want to answer numbers they don't know. And so changing it to meet patients in different ways, we create a self-schedule link on the website now. So someone go online and do this, something we've never been able to do before. That's new that this year. We do text messages now. We do the referral link within the text message as well. We're creating different channels so the patient can pick what they prefer. So it's not, hey, you got to meet me where you're at. Like I've had doctors who are like, you got to meet me where I'm at. And I'm just like, I don't want to meet you there. That's not how I like to do my things. I like to do my things, everything online. I don't like using my phone like that. My phone is, and I hate to say it's for games, phone calls. That's it. Anything else, I don't use my phone. I prefer to go online and I prefer to do things through portals.
Yeah.
That's just how, but everyone has their own preference in creating these multiple channels and allowing the patient to make the decision, I think makes them feel more empowered.
Hmm.
Because again, I'm still getting the information I need, but you're allowing the patient to decide. Because again, sometimes they don't feel to be grilled, but maybe someone's just okay with filling out a form. That's a
Yeah.
decision we have to ask and create those channels. And again, we're seeing that we've doubled our self-service and it keeps increasing. So it is a channel that no one thought needed, and now you can see it's actually working.
What do the patients want these days? They want self-service, they want to be handheld. All I know is they want reduced timelines. And and folks have been telling me, and there are different stories, right? But what does the inquiry to appointment cycle look for you? I mean, is it in days, hours, minutes? Uh,
So I think to it, you said it's ease. What patients want is to call in and schedule an appointment. That's it. I think there's an acceptable amount of things the patient knows they have to go through. I think when it comes to healthcare, what I've seen is patients have a tolerance level. And what I've noticed is if you spend too much time, you've now crossed where they become frustrated. Why am I answering this? Why do you need this information? Why are you asking me this? It's creating the understanding, giving them the reason why we need it is also as key. I think that the patients are more educated now than ever. They have so many things at their fingertip. They have
mm,
so many options. So you don't want them to reflect on you and say that was a difficult experience, even though they need us. You don't want them leaving and think that was difficult. You want them leaving like that was a pleasurable experience. That
true.
was a lot smoother than I thought it was. Oh, that was way faster than anything. Because again, I can hear those calls when I listen to my team's calls. Those are the ones I consider wins. Like, oh, that's it. Oh,
True.
that's great. Oh, I didn't know that. Like, that's why I like the referral process at times because we get everything up front. We create everything, and then all I do is call you. And that's why I like this squared. The referral comes in, automates everything. Everything's in there. All I gotta just make a call, say what date and time do you want, and the patient's like, oh, that's great. Now, sometimes you don't have that information. Now that patient's sitting there, I don't have that on me. Let me go get my, case number. Let me go get my insurance card. Let me get my attorney's information, my adjusters. Suddenly, now you're making like a report is due. And those are the ones where they become more and more frustrated the more we need to collect. So just trying to balance of what is needed essentially to make an appointment and what can be collected after the fact is key. Because again, some people just don't want to be burdened, especially if they're sitting there with pain. Like I've only been in real pain once in my life when I got my tooth removed. And I don't think I could have took a 15-minute call trying to provide you information. That's how
Mm.
I look at it. Like if I'm in that, it's trying to be sitting in that, understand the patient's experience, trying to understand what they don't want to experience in the time they need an appointment.
Sammy, you mentioned that when you listen to these calls and when someone's really happy, that's the win, and that's
Yeah.
what we are all aiming for, right? In terms of fulfillment. Uh, is there an incident which stays with you today, over these years or the last couple of years, which tells you, which always stays at the back of the mind, saying this is what it is. I mean, if you want to share something.
You mean like this is what is in a positive way or in a negative way?
I mean, we would want to listen to both, but
So I'll go with negative and I'll end with positive. So unfortunately, I do sometimes, I have a bleeding heart for this, and it does make it difficult times, especially when it comes to medication. When patients are dealing with their insurances, and unfortunately, it is a back and forth sometimes trying to get authorizations and requests done so the patient get the medications they need. And hearing that desperation and them
mm,
feeling they're on the clock or it's the end of the day or before a weekend and them just feeling hopelessly they can't be helped.
yeah,
That to me sometimes weighs on me. Like I'll be on weekends and then they'll pop up in my head like I gotta go check up on this on Monday. Like and it makes me feel bad that I had a weekend where I don't know what this person's going through. I don't. And this makes me sometimes a little frustrated, but those are when I do have that in my. That's where I believe the word empowerment. Like I said, it's a big part of how I try to manage my team, and what I try to empower with everybody is whatever you're empowered to do, do it. So when I come in that Monday and whoever's back in the office and I need to start getting rolling, I don't say advocating, but I start pushing what needs to be pushed to get that resolution.
Mm.
So understanding the negative side, the positive side is we are empowered to do these things. It's understanding what you can do and then doing the things you need to do to get it done for a patient. At the end of the day, it's somebody asking for help. I know it sounds so simplistic when you look at it that way. It's someone who's asking for help, regardless of where you work in healthcare. Because again, no one's just setting up an appointment to set up an appointment. I always make that joke. No one's like, everything's good. Let me go meet my doctor. It's usually because something's wrong.
Yeah, true.
I always say I've never gotten that call, but hey, I'm just checking up on you guys. Just want to see how my doctor's doing. No, there's something going on, regardless of the condition, our practice or any kind of practice, eye doctor, foot doctor, something's wrong, and I need help. This person's mindset is worried, nervous, anxious, whatever feeling they're feeling. I try to understand that. And that's why I always tell my team, they're not going to come in smiling on the phone call. And you
Yeah.
do get some patients that are very nice like that. But majority are in agony, suffering, or frustrated and feel helpless.
Mm.
And I think anyone that works in healthcare understands that the best way is Shoots and Ladders. You ever play that game, Shoots and Ladders, Candyland? That's
Yeah.
all it is. Is one wrong step, you can go 3 steps back, or sometimes you shoot up through the process and end up being authorized immediately. No one really knows, so you try to manage and understand what you can do to support our patients.
Mm. Sammy, tell me one more thing since and I'm curious because I've not gotten an answer, and I've been reading about it, and there are different ratios to it. What is, and is there, I mean, is there a doctor to front office ratio that for every two doctors, you need, say, five front office or the other way around? Is there such a ratio which exists?
I don't know that, number one. So I work with the contact center side, so I'm not sure how the operational side of the office is. But that is something I've always wondered, because I also think there is no perfect ratio, because it really depends to me what the volume of the patient.
Hmm.
Because again, if you're going to have, like I said, let's say you have one doctor, maybe they're double booking, you're going to need additional staff for check-in process. So I think it really depends on the volume, because really it's just about the patient experience. You don't want patients waiting too long. You don't want patients sitting in waiting rooms. Like, one thing I never liked about urgent care is like, oh, they get you in the back quickly, and then you're sitting in the back for a long time.
Yeah.
I'm like, is that good service? Is that going to a restaurant? Like, we can seat you, and then you're not getting your dinner till an hour and a half later. Is that a good experience? It depends on what people. Like I said, and that's why I feel like when it comes to patients or anyone's experience in healthcare, this is like an acceptable what I'm willing to wait. Like, everyone just knows it's gonna be a wait.
I'm just hoping not
And
a lot of urgent care folks are watching this when it goes
hey,
that.
listen, I'm not pointing out anyone. This is I mean, ER, whatever. It's just whatever you're going into, there's an acceptable way. I had my eye doctor made me wait 25 minutes.
Hmm.
Like, it's just kind of like the beast you accept in healthcare.
True. True. Uh,
Because unfortunately, you can't plan. Like I said, when I finally meet you as my patient, or again, same thing with phone calls. Like, one of the things that I thought was a good talking point, you mentioned about the scorecard. I try not to give my team a handle time, because you don't know the story you're going to come with. If I tell you only talk to you for 5 minutes, but your story is a 10-minute story, I'm not going to sit there and force my team to take that person on there. Again,
mm,
I treat every patient as you're the only patient I'm dealing with in that moment. I tell my team, it is my responsibility as a leader to worry about the SLA. It is my job to worry about the next call and make sure I have the staff to answer it. Your job, you're empowered to do what you need to do on that call to make sure that that person gets everything they're going to need. So when they do come to the office, it's smooth. But
true.
again, that's only the first step. I'm only the first step of the process. That's why I kind of do like contact center, because we are the face of the organization. It's the first people they talk to, and we are setting their experience to be the great. It's the joke I always make. Like, when you go to Chick-fil-A and say, "Hey, how can I help you?" in that pleasantness, that's what the call center is. We're that place, that first interaction they're going to talk to, and we start their entire journey with us. If you start negative here, then you're causing the doctor and the office now to have to bring them back into the positive. So I want
Yeah.
to make sure we do that as smooth as possible.
Makes sense. Makes sense. Sammy, tell us about your leadership style. What do you hire for? What do you tell your team? I mean, how do
Yeah.
you keep?
So I lead by example, number one. So I always tell my team, if I make you do it, I've done it.
Mm,
So I can take a call if I need to take a call. I'm not saying every leader needs to do that, just have always operated. Because again, how can I sit there, coach, and develop you if I don't know how to do things myself? And again, some people don't believe they need to. I just think there's a value of understanding it. Number two, I also believe in empowerment. When I mentioned to you when I joined call centers and I had that leader that saw more in me, he empowered me. It's not that he gave me a position right away. He did not say, "Hey, now you're suddenly a leader." He just said, "I see more in you," and just kept giving me opportunities to make decisions. He gave me opportunities to make the call and do what I thought was best for the patient, understanding what the organization's values are, and understanding what our process is, and then making the choices I needed to make sure my patients were taken care of. And that's
Hmm.
how I lead. I hire, and you mentioned, how do I hire? I hire for character. That's honestly my interview questions were built to identify the characteristics of somebody. Call center can be taught. I can teach someone how to use a CRM or EMR. I
Yeah.
can teach someone to read a script or follow processes. Those things can be taught. I can't teach you to be empathetic. I can't teach you to be on time. I can't teach you to make sure that you're accurate. Those are things that drive to me the character that I'm looking for in an individual.
Hmm.
And honestly, that's what my leader saw in me. And that's also one of my lessons I had to learn as a leader. It was a hard lesson to learn because, again, when I first started in leadership, I would look at my team members and see them in myself. And I'm like, oh, I remember when I was like that. Let me give them a chance because someone gave me a chance. And I
True.
got burned. And there's times where I got burned on that and had to learn lessons because I learned they're not me either. So it's
Hmm.
also understanding that each of my employees is an individual and understanding each individual. Some people require a little bit more handhold. So you mentioned my leadership style. It's also being a therapist. So I got to be a leader. I gotta be a
Yep.
therapist. I have to be HR. I have to be a guidance counselor. And it's like you have to do all this for your staff members. Each one requires me to be a different leader. Some of them
Yeah.
require me a softer touch. Some of them require me that be direct and tell them exactly what they need to hear. And other times I have to be. I know there's a podcast, but it's very true. I have to be the executioner. Sometimes I have to be like, "Hey, this is not the right place for you. You're not what we need, and it's not the patient experience I want to give them."
Hmm.
And understanding that you're doing all those different things. So I think any great leader understands you're not just one thing.
Yeah, you have to balance
And
both sides. I mean, you have a
yeah,
patient at the other end and the and your team, I mean, your colleague at one end, right? So
yep,
your perfect
yeah.
balance.
And at the end of the day, it's we're here to help the patients.
Hmm.
And that's like you said, how do I do the things I have to do? That's what I'm constantly keeping in my mind. Is like at the end of the day, it's not about me, it's not about them, it's end of the day, it's about these patients that need our assistance. And again, that's what our organization for. And again, that's why we partnered with Lee Squared. Again, we wanted something that could make sure the patient experience was the best experience they can get. And get
Yeah.
the information, we can track it and make sure that we're, create the accountability on my end to make sure my team is doing what we're doing. And then this way I can validate to the organization and anyone that ever questions the contact center, hey, we're doing what we're doing. Here's the data to show it. Because, something I wish I did years ago in my career, and I learned it later in life, which was be able to advocate for the contact center. I think every organization I work at, and anyone that's listening to this that works in a contact center knows this, you're kind of the least appreciated.
Hmm.
You are you're the face of the organization, but sometimes you're not looked at as vital as other parts of the business. And I get each part is vital, but we're the ones that are doing everything to bring that business in, to keep that patient happy and keep supporting the patient going forward. And I never was good early in my career about cheerleading. Like when we would have successes, like I told you, I wouldn't pause and appreciate it. I'd move on to the next thing. I was like, you know
Very
what? Okay, we hit the goal, yes, last month. Now let's hit this goal. Instead of taking a moment to celebrate with your staff, acknowledge the hard work, and then continue to the next step.
No, interestingly, I think you're completely right. In fact, what is the first point of interaction for a patient? It's a call
Yeah,
center or the
that's
operation or the
correct.
intake or the
Yep.
front office, right? And that has to be, applauded, and that has to be best, isn't it?
Say that again.
I'm saying that has to be applauded, right? Often,
Oh yes, 100%. Yeah, no, that's the thing I find interesting. It's usually when another part of the business meets the patient, they forget that we've already met the patient. By the time the patient meets the front desk, they've already spoken to us,
true.
or they went to our website, or they filled out our form, or whatever they needed to do. A contact center member had touched that patient. But that's also a huge responsibility. That's why I said I take it very heavy heartedly because I understand that also by the time it gets to them, if something was done wrong, now they're dealing with my team's area.
Yeah. Yep.
So that's why, I appreciate that the partnership we have with you and all the things that I've done is also about transparency and accountability. And that's what I meant by cheerleading. It's not just about saying, hey, I did everything great. It's also acknowledging when you did something bad. I love sports, so this is a football analogy. The cheerleaders keep cheerleading even when the team fumbles the ball.
Exactly.
And
Exactly.
that's my responsibility. Like, even when I make a mistake, it's not about beating down the call center. It's acknowledging it, identifying it, changing the process if needed, or reinforcing the good processes to make sure it doesn't happen again.
And like I
And
said,
you have
right?
to have that relationship with them.
And it's the first point of experience. Your patient experience begins there, right?
Yeah.
Yeah.
I always tell people, no matter how good food is, and again, you can tell I'm a foodie, but as no matter
I know
how
that.
good food is, yeah, exactly. But how good food is, you can't give bad service with it. So no matter how good the office might be, the doctor might be, our services might be, if the call center is starting them off with a horrible experience,
Mm.
they're not going to want to continue with us. And especially in a world that people have options, they have more options now than they've ever had in their life. It's at their fingertips. I mean, there's literally websites now that's all they do. ZocDoc, that's all they do is offer options for our patients. So it's not just about, hey, we gave them what they needed or we'll have what they need. It's also they want a smooth and great experience with that entire time. They want someone that's going to listen to them. They want someone that's empathetic. They want someone that is taking the time to acknowledge what that person needs. It's not just about, oh, you're just another patient. And that's
Yeah.
a lot of people feel when they go into the healthcare world. And every time I go to hospital, that's exactly how I feel. Every single time, just another chart to move down. And that's not how I want my patients to feel our interactions are. That's why, part of our quality assurance, we require empathy statements. We acknowledge the statements that they're saying to us because I want it to be a conversation. Yes, my team's got to do things that we have to do legally and make sure we collect what we need to see the patient, but you can still have that human interaction. That's why I don't do a handle tie. I believe in creating that connection with the patient. Because
Mm.
if I want him to go to that doctor's office, look, I had a great time. Or look, it was so nice when I talked to him. I had no issues.
In fact, you mentioned you hire for care, right? You
No
hire for,
character.
oh, character,
Yeah,
right? So,
character. Yeah,
because like you said, you can teach them everything else, call center, technology, and you mentioned technology. So I'll just dig a little more into it. Where does, and I had this question because, we now work with a lot of practices, providers who have acquired, procured technology over their, these point solutions over their journey, and now have a
yeah,
problem of plenty. And then
yes,
they come to us and want to consolidate. Where does, technology really help, and where does it get in the way, according to you?
yeah. So that's a very good one. So it's the problem that I've did when I first joined. Again, I'm talking to the operational mindset. So when I first came to healthcare, the first thing I noticed is there's not one standardized system. Every healthcare system is operating separately. It's not like one universal system, unfortunately. So the tools are out there, but it's like having my wrench one spot, my hammer in another spot, my drill in another spot. What Lead Squared helped us with is gave us a toolbox, but everything into one. So I just have to open it up, and that's all my team needs to be on. When I first joined here, they'd have to walk over to one side. That took some time to go get that information. Then they go to another side to get that information. It's the death by a thousand cuts. It's not that it's horrible, but it's death by a thousand cuts. And because those minutes add up. If my person is taking 100 calls a day and I'm losing 1 to 2 minutes per call, that's 300 minutes I lost in a day because we're
Yeah.
doing all these little things. And I'm just generalizing. It's not real data, but just generalizing that it's never the big things. What I've noticed in healthcare, it's never the big thing that's hurting us. It's all the little things. You have to verify this. Each insurance company requires a separate portal, or we get our referrals from 100 of different resources and trying to get them all to come through one tunnel. Because again, when you're in a call center, you're trying to get everything funneled in so your team members can just triage it. But if they're
Mm.
spending half the time foraging to collect everything they need, that is what was killing us in the beginning.
How so when you guys got in, how did you realize, and how soon did you realize this was the problem? Because we come across this with so many providers every single day. How
Honestly,
soon
a
did you?
time study, a simple time study. I literally just sat there with a timer and a spreadsheet, and as my team was doing, I was just documenting everything
Hmm.
and identified these were the things that I considered unnecessary. So that's number one, understand what we need to collect and not to collect. Number two, understanding how things came in. So understanding the multiple sources and how to drive them into one funnel. And then finding a system that helped us triage that. And that's where least squared came in, is
Yep.
how things would come in and then allowing the system to triage it for us. That eliminated the need for a resource to sit there. And again, the joke I make is the old school, phone system, I plug here, just to make a phone call. That was unnecessary. And
True.
understanding that, and again, it's also daunting. It's again, if you look at us too much, is we get hundreds a day. How can we change all this one step at a time? It started with we started with Excel. So tracking Excel first, showing how all the different things. So it gave us star data. Then we started with a little bit of a CRM system just to play around with it. We tried it with a small market. And then once we had the concept to show, and again, that's why I tell people you don't have to do it all. Because that's the fear. Everyone's like, I can't do it all at one time. Start with a small pocket and prove the concept works. And then once we were able to do that for our organization, we were able to, work with our marketing team and connect it with Lee Squared, and the rest is history. We were able to
Yeah.
show it, and then we started with one of our biggest regions, and we implemented it, and we've been doing that ever since now. And our second region is going this month, and then next month will be our third region. So I'm super excited to have
Yeah.
all our regions in Lee Squared.
Congratulations to you.
Yeah, thank you.
And one last question, I think, since you mentioned about Lead Square and the partnership, and you would have in your, long career, would have used a lot of tools, right? A lot of
Mhm.
CRMs as well. Why do you think, and where do you think Lead Square really works?
So the reason I'm the biggest advocate of Least Squared, the number one thing is you built the API that I haven't seen with any other vendor that I could work with, which is you ran the insurance. So you, as I mentioned to you, with other vendors, they couldn't connect the API for the insurance. So a big part is just collecting insurance and validating that they work. And there's some tools that we use that we still have to manually do that in our EMR system.
Hmm.
V Squared was able to create an API that didn't require that. So, as I mentioned, now my team only has to go to one mailbox for our referrals. You can put the information in, you can now run the insurance, validate it, and everything gets pushed in and automates documentation. So it uploads everything into Athena for us as well. So what Lead Squared gave me that others vendors that couldn't or compare to, it gave me one system. So as I mentioned to you, finding the right character and training, I now don't have to train someone in 37 systems or 15 systems or even 10 systems. I'm training them in one system.
Yeah, I think that's
And I
the
think that cut down training, it cuts down errors because again, also Lead Square gives you the ability. I hate using the word dummy proofing, but it is. It eliminates errors being possibly made because you create checks and balances. So it will stop them from submitting something where some EMRs don't do that. If you put it in incorrectly, it'll let you keep going. At
mm,
least Squaresbill has like an additional layer filter. And again, as I said, if you train someone new that's never done, this helps them guide them through the process and helps eliminate errors, which is, again, that's my biggest win since I've been here is being proactive. I think too many vendors try to sell you on if an error is made, you can identify it. And I always say it was too late now. The error is made. Now and I always hate to say this, it tarnishes us in the view of that patient's experience. It tarnishes us in the office's eyes. It will make us look bad in the doctor's eyes. And I'm trying to let them all know that I'm doing our best to make sure every interaction is perfect. So if I can get someone that helps me or partners with me in a proactive way, that means you're stopping the error from ever happening, then you're going to have a better experience for everybody that we support. And that's literally what's been happening since we've partnered with you guys.
perfect. I think this helps. Sammy, any last advice? I mean, last advice or just an advice? Any advice for anyone who's coming into the industry or for practices who trying to streamline operations, call center operations, for anything which you feel is not being done right by the industry in terms of patient access?
So the only advice that I would give is when I first joined healthcare, you get a lot of this is the way it is. You get a lot of people who are like maybe I don't say
Yeah.
beat by the system or they just accept how things are. Say this is how I don't believe that's the right way. I even actually did that to somebody and I reflected. I was like, man, I wish I didn't say that. I was like, oh, we tried that and it didn't work. It's like it doesn't matter. Even if I tried and I failed, he might succeed. And I regretted saying that to him. And it's
Hmm.
something I don't live by. Anytime someone tells me you can't do something, like, well, I'll start small. Like I said, I'll start with one office. I'll start with one provider. Just start. Take an action and build your case. Because when
Yeah.
you can build the data and prove your point, it's hard for anyone to refute it. And that's what we've been doing since I've been here. Since Janine had brought me to the organization, me and her together have been constantly proving our points. Like we never just say, just believe us. We never just say, this is what I feel. When you bring the data and show it and you show the results and the return on investment, I haven't experienced to know yet when it's done correctly. But when I've come with the mindset of, yeah, we just got to do it, it doesn't work out. So that's my biggest advice is don't
Yeah.
fear the no. Start small and build your case and keep growing it from there. Because again, that's how you get buy-in. You get one provider to agree, one office to like you. They tell their colleague and you grow. And I always make a joke to everyone. I'm like funky cheese. No one likes me at first, but then over time they start really liking me. That's how I look at it. And it really does work. It's being consistent and just trying to do what's right. And I think at the end of the day, if that's where your mindset is and that's what your intentions are, and you just
Mm.
take one small step, the next steps become easier and the next steps. And when you're looking back, you don't even realize you walk a mile. And that's been my biggest growth in healthcare. It's just never being overwhelmed by what's in front of me. I just look down and just keep taking those steps forward. And then now, look, I'm 2 years into it. I'm officially a director. I am in an organization that I feel like that we're doing real good, and we continue to do real good, and it's continuing to grow, and it's working. And I'm excited for the journey we have. I'm excited for the partnership we have with you, and what's next to come is just so exciting. Just because I never feared that first step. I always fear of complacency. Complacency is where I think people fail the most.
I think a good way to summarize what you said is stay curious, challenge the normal, optimize and innovate. It will happen naturally, right? I mean, if you just stay curious and challenge the normal, isn't it?
So let's edit my part out and just add your part, and I just say that was great. Yes, I like that. But yes,
Thanks a lot for doing this, Sammy.
no, it was my pleasure.